Hi, this is Dr. Sridhar Vennamaneni, internal medicine with Prathima Medical Center in Kukatpalli, Hyderabad. Today we'll be talking about osteoporosis. Osteoporosis is a progressive bone disease which increases your risk of fractures. And in India, we have close to 10 million patients suffering with osteoporosis. Typically, if you look at what happens in the body as we age, the bone mass gradually decreases. There's a constant turnover of bone inside the bone marrow. There's new bone forming and old bone is being replaced. Usually the bone mass starts increasing from childhood until the age of approximately 30. And once you reach around the age of 65 and older, there's a higher risk of fractures because of reduced bone mass. Most patients with osteoporosis are asymptomatic, and it's patients with severe osteoporosis who have a higher risk of fractures, especially the spine fractures and hip fractures that suffer the most. Now, in terms of how do we detect osteoporosis, there's a simple scan called the DEXA scan, which involves, it's a 20-minute test, costs about 1,500 to 2,000 rupees. And it's a simple machine that takes x-rays of your hips and your back. And it also can take x-rays of your hands to look for osteoporosis. So there's a score that we get. Based on that, we classify you as having osteoporosis or not. Now, like I said, most people with osteoporosis are asymptomatic. The patients who develop symptoms are patients who have fractures from osteoporosis. And typically the most common fractures are the spinal fractures, lumbar fractures. And I'm sure most of you have seen patients with back pain, patients who are stooping forward, bent forward walking. And typically those are patients who have osteoporosis in the spine. What are the risk factors for osteoporosis? In general, the risk of osteoporosis increases with aging, especially in women beyond 65, postmenopausal women, there's a higher risk. And in men, there's a higher risk after 70. And patients who are sedentary, patients who are consuming excessive alcohol, patients who are smoking persistently, excessive smoking, all these are risk factors for osteoporosis. In addition to this, other risk factors include family history. If there's a parent with or a sister or brother with osteoporosis, there's a higher risk of osteoporosis. Also, we see patients who are thin-built, patients who are malnourished have a higher risk. Now, in women, the risk increases because of lack of estrogen as they age. And so we see that even patients with breast cancer, women with breast cancer who are on anti-estrogen treatments have a higher risk of osteoporosis, and they need to be tested with a bone density test. In men, the risk increases, especially with smoking, alcoholism, and men with prostate cancer who are being treated with injections to reduce the testosterone. The risk is high. The other risk factors include patients with hormonal imbalances, patients who have excessive thyroid hormones, or patients who are on medications that increase the thyroid levels, or patients who are on steroids for autoimmune conditions, or patients on anti-cancer treatments, patients with excessive cortisol steroid levels or excessive parathyroid hormone. All these are risk factors for osteoporosis. Now, the other risk factors include, like I said, lack of exercise is a very important thing. Patients who are sedentary have a significantly higher risk. And so exercise is very important in preventing osteoporosis. Now, what are the complications of osteoporosis? Now, most of the complications are basically patients who develop fractures, spontaneous fractures. In patients with severe osteoporosis can develop fractures even with simple bending forward to pick up something, or patients with significant coughing can develop fractures in the spine from osteoporosis. Now, patients who are frail or who fall down with osteoporosis have a significant higher risk of hip fractures and other fractures, including arms and femur fractures. Now, studies do show that once you have a hip fracture, especially in the elderly, there's a significant higher risk of decline later in life and leading to frail and debilitating state. Now, how do we prevent osteoporosis? The risk factors I forgot to mention, lack of calcium and vitamin D also. For some patients, because of inflammatory bowel diseases, if they have colitis or if they have celiac disease, all these are conditions where there's a problem with absorption, and so these patients cannot absorb calcium and vitamin D, and they have a significantly higher risk of osteoporosis. The same goes with patients with autoimmune conditions like rheumatoid arthritis or lupus erythematosus. All these are conditions where there's increased inflammation, and which in turn can increase your risk of osteoporosis. In addition, the treatments for these conditions with steroids can increase the risk. So it's very important that these patients get tested with a simple bone density to see where they are, because patients could have early stages of depleted bone density, and it's called osteopenia. And if you do have that osteopenia, then there are ways to prevent progression to osteoporosis. So getting a bone density is extremely important. Now, the other prevention measures for osteoporosis include, number one is exercise. The recommendations are to have at least 30 to 45 minutes of exercise every day. Exercise could be cardio as well as strength training. So cardio involves brisk walk, jogging, treadmill. It could be dancing, running. All those are things that can increase your bone density. Strength training, at least 2 days a week of weightlifting, lifting some weights or doing some push-ups or doing some bands. Even yoga has been, Tai Chi, all these have been shown to increase the bone density and reduce the risk of fractures. Now, in terms of diet, studies show that most patients should have, especially if you're above 40 years of age, calcium intake of about at least 600 milligrams, 600 to 1,000 milligrams is recommended. The current recommendations are to try to get calcium in the diet, because calcium intake in regular patients can increase the risk of kidney stones, and also can increase the risk of calcium plaque building in the blood vessels and increasing risk of heart disease as you age. So the recommendations are, unless you have an absorption problem, it's better to get calcium through your diet. In the regular diet, we have calcium in all the milk products, so it's good to have low-fat dairy products. The other calcium foods are usually dark green leafy foods, soy products. All these have calcium in them. Now, in terms of vitamin D, studies do show that lack of vitamin D can increase your risk of osteoporosis, because you need vitamin D to absorb calcium in the bloodstream, which in turn will help with the bone density. So the current recommendations are most patients should have at least 2,000 international units of vitamin D. And there's a simple blood test to check your vitamin D, and vitamin D deficiency is extremely common in India. And we see close to 85 to 90% of patients have vitamin D deficiency. So getting tested for vitamin D deficiency is very important. The treatment options, in addition to exercise and diet, we have different treatment options for patients with osteoporosis. We have oral drugs, which can be taken once a week or once a month. And then we have injections that can be given once a year. And there's a once every 6 months subcutaneous injection. All these have been shown to reduce the risk of fractures in most patients. There are newer treatments where you may have to take a subcutaneous injection every day for 3 to 6 months. So there are good treatment options. So the current recommendations are that if you are at a higher risk of osteoporosis, if you're a woman who's postmenopausal, if you're a man who's above 70 and has a risk of falls, is on cancer treatment, or if you're on steroids for whatever reason, or if you have autoimmune conditions, or if you have problems with absorption because of gastrointestinal issues, you should be tested with a simple bone density, and further treatment can be pursued subsequently. So this is an example, a photo of a patient who is at the age of 55 has a normal spine. The patient is upright, straight, and this is the lumbar spine, and that's the hips and the lower legs here. Now, as the patient ages and gets to 65, once you start developing osteoporosis, you can see that the patient is slightly bending forward, and because that's the early stages of bone loss in the back, and that's why the patient is bending forward. And here, as the patient is close to 75, you see a lot of patients bending forward, stooping forward, and that's because they're developing osteoporosis, and so the spine is a little more curved here, and so they're leaning forward. And if you look here, this is a biopsy of a normal bone, and you can see the bone's really strong. And this is somebody with osteoporosis, where you can see it's like sponge, and it's easily fragile and easily breakable. So that's the difference between a normal bone and osteoporosis. In this picture, in this photo, what we can see is this is a spine, vertebral spine, the lumbar spine in the back. And this is a normal vertebrae, which is strong. And here you have a vertebrae that's squished because of osteoporosis. There's a compression and there's a collapse of the vertebrae here. The same thing here, this is L1, and you can see this compression of the vertebrae. Normally, it should be strong and wide like this. Here, you can see there's a compression. So once there is a compression of the vertebrae, patient automatically has to bend forward because he's not able to stand straight. And patients do develop a lot of back pain because of that. In this patient, you can see this is a picture of a patient with a normal hip, and you can see the bone density is really strong. And this is somebody with osteoporosis, where you can see, you can clearly see that the bones are much weaker. And in this picture, you can see somebody with osteoporosis developing a fracture and requiring surgery. Now, this is just some of the ways to keep your bones strong. Like I said, one of which is to exercise, stay active, walking. So here you can see regular weight-bearing exercises like walking, aerobics, strength training, all these are important. Quitting smoking and limiting alcohol is extremely important in increasing the bone density. Adding calcium through mostly dairy products, soy, having soy products, nuts, all these have been shown to prevent bone loss and keep the bone strong. And supplementing with vitamin D is extremely important. Some foods with vitamin D include fatty fish like salmon, mushroom, cheese, eggs. All these are vitamin D, which is important. And in addition to that, like I said, you need to get tested for vitamin D, and there's a capsule once a week that you can take if the levels are reduced. And once the levels improve, you can take the vitamin D once a month. There's also studies that show that protein powder, proteins are important for bone strength, whether you're having milk products, low-fat milk products, eggs, beans, or even a tablespoon of protein powder added to your juice or milk is another way to keep the bone strong. Thank you.